Hello, everyone. This is Himanshu Sehgal, co-founder Pharma Shots. We are yet again with another episode of CXO Talk. With us, we have Chief Medical Officer of Dr. First, Dr. Colin Banas. So, thank you so much, Dr. Banas, to agreeing and talk to us. I know you are a busy man. You are obviously attending a conference. You have taken out time to talk to us from your hotel room. So, thank you so much for that. Without further ado, let me just jump to the questions. Uh, so, uh, my first question, very basic, is that can you tell us about the company's journey, why the name Doctor First? All these questions, simple, basic, for everyone.
Yeah, sure. And thanks for having me. I'm never too busy for these kinds of events, so this is perfect. Dr. First actually celebrated its 25th year birthday this year. So the company was formed in the year 2000, primarily as an e-prescribing company. So if you think back to the year 2000, what were we all doing in healthcare? It was all paper, paper
Yeah.
prescriptions, paper charts, everything. And Dr. First was actually pioneering the charge towards electronic prescribing. So, over the course of 2+ decades in the e prescribing space, which obviously took off a few years after 2000, through a series of relationships that we had formed with pharmacies, with providers, with electronic health records, with even pharmaceutical companies, the organization has really blossomed into what I would call end-to-end medication management. So from the point of, deciding that a patient needs a prescription all the way to helping that patient pick up and remain adherent to that prescription. If you think of the journey of patient medications, we actually have influence points and solutions all along the way. And the name Dr. First actually came around again very, very early in the year 2000, mostly as a way to say we're trying to put the doctors back in charge of what they're doing, their autonomy. We want to put the doctor first in terms of the tools that we're providing them with. Now, obviously, with the tools cater to more than just doctors. Healthcare is now a team sport, always has been, but the name is stuck, and we're pretty proud of it.
Awesome. So firstly, congratulations and happy birthday, 25th, to the company. Um, so Dr. Manis, I was reading about the company and, going through the website. Um, it's something very peculiar, interested me. You had a partnership, you just recently had a partnership with the organization called Wise Hospice Options. And they're all, and in that in that partnership, it was mentioned that the prescription timing is reduced from 20 second to 2 second. So this was something very remarkable, and obviously it caught my attention. So what exactly, firstly, what is this partnership with Wise Hospice, and how actually you reduced to such a tremendous time, like 2 seconds? Can you talk about that?
Yeah, sure. So we've been partnered with Wise for many, many years. And this particular success story stems from a use of AI that centers around data normalization. So what's interesting in the e-prescribing and medication management space is that even after 20 plus years of doing this, there are still different standards, there's different compendias, there's different ways of writing prescriptions. In fact, there's a study out of the University of Michigan about 5 years ago that shows the most common prescription instructions, or SIG, is take one tablet by mouth daily. But that in their analysis, there's over 832 different ways that doctors will write that. Take one daily, take one by
Mhm.
mouth, take one PO, take one oral. You can imagine all of these different permutations. Lay on top of that there's different drug compendias depending on which software systems you use. And even though we've done a very good job of trying to standardize the process, there's still mismatches. There's still areas where the data doesn't flow, that we
Mhm.
haven't fully achieved what I affectionately call semantic interoperability, even in the medication space. And what this particular success story centers on is an AI tool that actually normalizes this data. So it can take, no matter what the compendia is, or even if the doctor or prescriber uses free text and just, puts into their system instructions that don't even codify to any of these compendia, we normalize it. So we turn that prescription back into structure, and we turn it into the structure that the receiving system is expecting. And that's really important because then you are saving time having to re-input or re-key this data into their system to make it match the way that their system needs it. And the reason this is important is because when it's not codified, when it's not received in the appropriate way, you can't perform all of the necessary checks. You can't do drug-drug interactions, drug allergy interactions, because if it's free text or it doesn't match, the system doesn't know what it's looking at. So, Wise Hospice actually has multiple different systems that they're using to process prescriptions, and they were having to rekey a lot of this stuff. And so we are normalizing it, and if you can imagine taking, a manual data entry, finding your mouse and going over to these fields and re-inputting it, and now this stuff is just magically happening, and all the receiving clinician needs to do is verify it, you're going to get a tremendous time saving. So there's an efficiency gain in all of this. And actually, more importantly, there's a safety gain in this. Getting it appropriately codified means it's available for all those use cases I just talked about. And also, it prevents what I call the fat finger, where the one turns into an 11 when they're typing it, or when the provider, mistypes 3 times a day and instead of gets hit 4 times a day. That's how people get hurt. Medication management, medication reconciliation requires clean and dependable data.
No, this is fantastic. And I've always thought about the problem you called fat finger. I've always thought about this, but you know, but this is very insightful for me as well. That this is how you can match the data. So amazing. Thank you so much for telling us about that. Another partnership which I read about was with the Elsewhere, and the integration of EHR with them. So how this partnership and this integration is going to help clinicians? Can you shed some light
Yeah,
about that?
yeah. This partnership with Elsevier is a brand new one, and it marries hand in hand with the Doctor First mantra for this year, which is trying to become an AI first company. So not just AI integrated into our solution sets, one of the use cases I just talked about, but also AI in the way that our teammates and employees, colleagues are actually doing their day-to-day work. What's great about the Elsevier partnership is that it's an opportunity to implement and integrate directly a an LLM model that is entirely built on clinical content that Elsevier curates. So we're talking about textbooks and, more importantly, peer-reviewed journals, and the ability to use this LLM in real time to manage your patients, to ask the appropriate questions. And so um, we're going to be doing this not only in our mobile solution, which we call iPrescribe. So imagine having a tool on your mobile device, your phone, where you can write prescriptions, but also ask the engine. And it's called Clinical Key AI from Elsevier, if folks want to check it out. Ask questions, what is the appropriate treatment for this patient? How would I dose this, et cetera, et cetera. We're also going to integrate that into our engine and our web-based e-prescribing platforms as well. And so it's just an exciting time because realistically, there's no way for providers to keep up with all of the changes that are coming for medical guidelines. It's just impossible. There's new literature every day. And so something like Elsevier, which is curated, which is up to date, and which again is based on vetted clinical content. So this is not the chat GPT that you run out to the web browser and look up. This is actual clinical curated content. This is an exciting time. And so we just kicked this off, major announcements within the last month. And you referenced a conference that I'm at right now. We're actually doing a keynote with them tomorrow morning. So it's really exciting.
Oh, awesome. So I'm looking forward to, receiving some updates from that as well. We would love to include that in our analysis, in our interview. So thank you for telling us about the Elsevier partnership. Another question about another partnership. I mean, you guys have done so many partnerships. Another question is about um, uh, Pediment Healthcare. So they have this. They have You have collaborated with them for or partnered with them for some technology, and I read about predictive analytics being used to increase the adherence rate. So how how does that work? It's an interesting point which I clearly did not understand much, but would love to understand. And then please, if you can talk to us about that.
But was this the Hackensack
No,
EHR?
no. It was Piedmont Healthcare.
Oh, Piedmont. You're right. You're right. We have a lot of partnerships. We actually integrated into over 270 distinct different EHRs. So, Piedmont was an exciting opportunity that we just shared the stage with them at HIMSS last month.
Yeah.
This one was interesting because what they are able to do is take our medication history data for populations. So imagine Piedmont is a large health system that's spread across a vast swath of Georgia. They actually have presence almost everywhere. So they are responsible for a large population, and they take on risk. They have risk-based contracts in their accountable care organization. And so you can't manage what you can't measure. In order to manage these chronic patients, they needed access to medication history data for those entire populations. And that's one of the solutions that we're able to partner with them for. And so the way you can imagine it is you define the cohort and you define the cadence, and we'll give you the data. So you have this, let's just make up a number, 10,000 congestive heart failure patients, and you need to make sure that they're staying adherent, because adherence is probably one of the most important things that you can influence for these chronically ill patients. And so you might want to see, are they getting their meds? And you might need to know that, once a month. So every month for those 10,000 patients, we're going to do a query and then give them back the data and give them the analytics and say, here's 1,000 of them that are non-adherent. You might want to, schedule your interventions there. They took it a step further and partnered with data scientists on their own team and actually started to develop predictive analytics around multiple different data points. So zip code, primary care physician, other medications on their list, chronic conditions and comorbidities. You can just imagine. And they actually used machine learning to start to predict, in addition to the data that we're giving them, to predict where they need to spend their intervention time and dollars. And so that was pretty cool. They found things like zip code is highly predictive of patients who are non-adherent, which may or may not be surprising. You can imagine some zip codes have poor social determinants of health or support systems, things like that. But also things like primary care doctor. There are certain primary care doctors that they found were more likely to have non-adherent patients than others. And so it's just interesting, and they're continuing to refine and to improve the model. And then they use those predictions to give to the frontline clinicians to say, this is where you need to focus. This is where you need to go spend your time, because the
Mhm.
rising tide lifts all boats. You need to get all of those patients to certain adherence levels so that you can prove to the accountable care organization that you're hitting your metrics. And that's where you get into things like CMS star measures, et cetera, et cetera. So Piedmont was really, cutting edge with this stuff, using our tools, our data, and combining it with other data points to create this model.
This is very interesting, honestly. I'm very amazed with the kind of detail they are working on, and obviously I understand that adherence is big problem. I myself was part of Novartis, and we used to discuss about this at a great length. when I was there. So, a very generic question now, because I've already spoken about three partnerships. So I want to, tilt the conversation to different direction. What is your viewpoint? Because while I am still in healthcare, but while I was with pharma company, I realized that they lack a lot of technology infrastructure, analysis of the big data. So how do you think Doctor First can bridge that gap within the healthcare space, specifically when I talk about pharma companies? So, how do you play that role, or how does your technology, rather, I would ask, how does your technology play the role?
Yeah, it's all about connectedness. It's all about interoperability, which is something we've been talking about for 15 years, as you well know. And if you go back to 2010, we really thought we would have this solved by now, and yet we're still talking about it, and
Yeah.
different versions of it, such as TEFCA is a big buzzword that you'll hear now. What I would say Dr. First brings to the table is a legacy of connections. Over 270 unique EHRs with deep integrations, connections to over 70,000 pharmacies, connections and relationships with pharmaceutical companies, and even connections with patients via adherence solutions that are SMS and individualized based. So what will be interesting and what we can help bring to it is the data and the insights from these connections. And more importantly, and when it's appropriate and safe to do so, we can actually serve that data up in real time to the necessary party. So think about something as painful as prior authorization or price transparency, being able to empower the doctor, the prescriber, as well as the patient in real time with the necessary steps or status for these prior authorization problems, and then being able to automate as much as possible, again, when it's safe to do so, so that we can reduce the friction. I think it's all about friction reduction, not only for the provider, but also for the patient. You'll often hear me say that the mantra for Dr. First is to get patients on and keep them on appropriate therapy. And what I would say as the chief medical officer is I also want to make that experience as joyful as possible, meaning reducing the friction for the patient and the provider. So, to answer your question, big data requires connections and requires insights. And 25 years, we're in a unique position to provide that.
Awesome. So this question is maybe it sounds like an out of a box question, and maybe you can, if you want to, do you envision, uh, patients' data, and the kind of data, EHR data, EMR data, all these data which Dr. First is generating, being used by pharma manufacturers, for R&D or for manufacturing purposes, all those kind of. So, do you envision being utilized that data in that way?
No, we don't sell our data to pharma. I mean, first and foremost, I think that's important. What we're able to help with on our end is de-identified and anonymized data that we can then mine on our end for insights, and then being able to use those insights to influence adherence. And again, go back to the mantra, get patients on and keep them on therapy. So the more that we're able to individualize and personalize the experience for the patient on behalf of the prescriber, the more everybody wins in that medication management journey in terms of getting patients on that therapy. And so, I think what you're getting at is drug development, perhaps, and things like that, where you're really seeing AI and LLM start to really take off. I think our role at Dr. First is more on the experience side. How can we improve the experience for the prescriber? How can we improve the experience for the patient? And using the data on our end to improve the solutions. So understanding on our end where the friction points are for the prescriber, oh, they never get past this screen, or they're always forgetting to put a diagnosis code in here, and therefore they're being required to do a prior authorization. We can use that utilization data to improve
Mhm.
our experience, which then downstream improves the experience for the entire ecosystem. And same thing on the patient side. We can understand more personalized experiences on behalf of the patient, and then serve up individualized content that can help them on their medication journey, whether it's better education or things like cost savings opportunities where we can match the patient up with the appropriate opportunity, all about reducing the friction. So that's really the doctor first difference.
Okay. Can you talk about any, so there are multiple offerings. Can you talk about any solution or offering which you are working on at the moment and then, which is not yet live, I would say, or it's kind of in a making, which could be revolutionary. So can you talk about that?
Yeah, it's an exciting time. For this year, we've really doubled down on specialty medications. So if you look at the data right now, 3 out of every 4 medications that are in development for this year are specialty medications. It's almost as if you can say specialty medications aren't so special anymore. That's becoming very commonplace. And so specialty medications come with their own set of unique challenges, particularly around price transparency, prior authorization, and the way that you can connect patients with services. So that's one of the things that we're really doubling down on is how can we improve the specialty experience? The other thing, and it goes hand in hand with this, is prior authorization. We're working on what I would call total benefits management. So right now, there's actually, and it's still a very fragmented system, but a lot of times when people think of prescriptions, they think of your prescription benefit. You go to the local pharmacy and you provide them your prescription card and you get your pills. Well, a
Yeah.
lot of the new medications are actually under your medical benefit. So think of high dollar infusions or biologics, things like that. There's even worse insight into what medical benefits are covered for pharmacy interventions. And so we're unifying the experience, right? It should be one-stop shopping, one-stop visibility for the provider because they don't have time to figure this all out. It's also very hard to navigate. So total benefits management is one of the things we're focused on. And then the last one is really exciting is we're really trying to shift the paradigm for e-prescribing. Right now, it feels very unidirectional ping pong, not very collaborative. It's sort of like write your script, put it in a digital envelope, and press send. And if there are things along the way that need to be done, you start to get into this, perpetual ping pong back and forth, and there's delays. Things need to be switched or changed or not covered. It's all very antiquated. And so one of the things we're working towards is what I would call prescription orchestration, treating that prescription as the complex medical order that it is, and bringing all of the necessary parties into the process so that we can improve the experience and improve that adherence equation that I talked about so fondly earlier.
Awesome. Okay, so we've spoken about a lot about data, a lot about EHR and all those things. So one very specific question which comes to mind is about the data privacy. And you have actually touched upon that, that you don't sell patients' data, you sell the insights from it. So, and kudos for that, but how do you make uh, sure that data is secured? And what are the steps you are taking? And although, I mean, and it's not just me, I guess it's I'm pretty sure other people might have also asked you this question.
No, it's important. A couple of things. One, we are entirely hosted in the United States. We are SOC 2 and high trust certified. So those are the levels of assuredness
Yes.
around data protection, HIPAA as well. Of course, all of our employees are HIPAA trained when they're dealing with patient data, et cetera. And then we also give patients choice. There is autonomy in the messaging or in the solutions that we're delivering to them. They can opt out at any time. Very few do, by the way. It's less than a 1% opt out rate. But there's autonomy in our solutions as well. And so, again, data is secure, data is hosted, on our soil. When we work with cloud-based vendors, same rules apply, same security assuredness apply. And so, and then as you mentioned, I touched on earlier, we're not selling the data, period. We're using the data on our end to improve the experience and to improve the patient outcomes. So it's something that we take very, very seriously. It's something that we train for on a semi-annual basis, and we always continue to strive to the highest level of assuredness.
Thank you so much. Enough of our shop talk. I can always ask more questions, but I think you're already exhausted, and you have spent the whole day in a conference. So I don't want to take much of your time there. Uh, so a lot of shop talk. Let's talk a final question. Um, can I know a bit about Dr. Colin Banas as a person? Um, you know, about your personal life, interest, hobbies, all those kind of things.
Oh, yeah. Well, I have two kids, 7 and 10 years old, so that keeps me pretty busy. It's probably a bit cliched, but I'm a physician who loves golf. So I'm a big golfer, avid golfer. Chances are, if I'm not, at the keyboard, I'm trying to get out and about on the course. The other thing I like to do is tinker. I'm a big technology nerd, so I like building computers. I like, playing with
Oh,
handheld tablets, and yeah, I'm not a big hands-on keyboard guy. I'm not as good as some of my colleagues in terms of coding and things like that, but I just love to tinker. I love to understand. But first and foremost, I'm a dad. 7 and 10 years old keeps you pretty busy. But like I said, if I can find the time, I'm out there hitting the links.
awesome. So thank you so much. It was lovely knowing about Dr. First, and obviously great knowing about you too. So once again, thank you so much for your time. It was lovely talking to you. And once again, why I'm again thanking you is because you've taken out time after a whole day of spending in a conference, and then spending another half an hour, 1 hour with me, answering the same questions which you have been answering in the whole day. So thank you once again. It was lovely meeting you, and I hope to meet you once again. For more questions on about Dr. First and new achievements and milestones which Dr. First achieves.
Yeah, happy to do it. I appreciate it. It was lovely to meet you as well.
Thank you.